So the prompts for discussion board, week number 8, select a recent peer-reviewed study that applies behavioral statistics in a way that interests you. Address the following: summarize the study, briefly describe the research question, methodology, and key findings. Statistical methods, identify and explain the statistical techniques applied in the study, e.g. regression analysis, structural equation modeling, ANOVA. Critique and interpretation. Were the statistical methods appropriate for the research question? Did the authors provide sufficient justification for their statistical choices? Were the results interpreted correctly and meaningfully in the context of behavioral research? Application to your field. How might these statistical methods be useful in your own research or practice? So, study title: Spiritual Intelligence and Spiritual Care Among Nursing Students in a Selected University. And this was about 7 months ago. Results of the peer-reviewed study. Research question. The study aimed to assess the levels of spiritual intelligence among nursing students and explore the perception of providing spiritual care. Methodology: a descriptive cross-sectional design was employed. Data were collected using standardized instruments measuring spiritual intelligence and perceptions of spiritual care. The sample consisted of nursing students from a selected university. Key findings. The results indicated that nursing students exhibited a higher level of spiritual intelligence in the domain of critical existential thinking and lowest in conscious state expansion. So that's CET and CSE. Overall, students demonstrated a moderate level of spiritual intelligence. Additionally, students reported a very positive experience in providing spiritual care. Statistical methods used. The study utilized descriptive statistics to analyze the data. Means and standard deviations were calculated to determine the levels of spiritual intelligence and perceptions of spiritual care among the participants. Critique and interpretation: appropriateness of statistical methods. The use of descriptive statistics was suitable for this study as the primary objective was to assess and describe the levels of spiritual intelligence and perceptions of spiritual care among the nurses. Justification for statistical choices. The authors appropriately chose descriptive statistics to summarize the central tendencies and variability within the data, providing a clear description of the students' spiritual intelligence and experiences. Interpretation of the results. The results were interpreted accurately, highlighting specific areas of strength and potential improvement in students' spiritual intelligence. The positive perception of providing spiritual care suggests that students feel competent in this aspect, which is crucial for holistic nursing practice. Application to your field: incorporating these statistical methods into your research on spirituality and critical thinking in nursing can be highly beneficial. Descriptive statistics can help in 1. Assessing baseline levels, understanding the current levels of spiritual intelligence and critical thinking skills among nursing professionals and students. 2. Identifying training needs, highlighting specific areas where educational interventions are needed to enhance spiritual care competencies. 3. Evaluating program effectiveness, measuring changes in spiritual intelligence and critical thinking before and after implementing targeted training programs. By applying these statistical techniques, you can gain valuable insights into the interplay between spirituality and critical thinking in nursing, ultimately contributing to improved patient care and professional development. A guide for critiquing a research article. Summarize ever so briefly what it did and what, if any, novel contribution it makes to the field. Then go section by section and apply what you know in critiquing strengths and limitations. A. Is the review of literature comprehensive or of appropriate depth? Does it synthesize pertinent evidence, making evident what are the gaps in knowledge? Is there a theoretical underpinning that is recognized and guides? Is there a clear statement of aims, purposes, and hypotheses if applicable? Is it going to lead to new knowledge? Asking something that can be answered and answered within one study. Asking something that can be answered and answered within one study. Is the design appropriate for answering the research questions? Is the sampling appropriate and clearly described? Recruitment described. Justification for sample size. Is the procedure for data collection described adequately? If there is an intervention, is it adequately described? Is the intervention evidence-based, novel, of worth? Are the methods for measuring phenomenon described adequately? Is there a statement of what each measure does and how it does it? Review of various types of reliability and validity established. Are the methods for data management and statistical analysis of the data described? Is there some description of ethical considerations? Do the results answer the research questions? Do they use appropriate means for conveying the results, e.g. charts and tables? Yes. Does the discussion section, which I just read, include an overview of key takeaways? Does it provide explanations for the findings and linkages with previous evidence or thinking on the topic? Does it make implications, e.g. for practice, leadership, education, or future research? Does it include a paragraph identifying study limitations? These are critical elements a reviewer is typically asked to comment on when they do a peer review. An editor will likely also ask how well the manuscript is written and whether it is an appropriate fit for the journal.